On a normal Saturday afternoon, everything seems perfectly fine, but heart attack rarely arrive as completely sudden accidents. The event is typically the final stage of a biological process that started decades earlier. This timeline charts the unseen activity inside an artery over 30 years. Layer by layer, deposits of fat and cholesterol called plaque build up along the inner walls. These accumulations sit quietly inside the artery wall, acting like a ticking time bomb. Because this build-up does not trigger any pain receptors, a patient can live for decades with a critical vulnerability, unaware that their internal safety margin has already vanished. This total absence of symptoms is what makes the build-up so treacherous. The heart is most vulnerable when the patient still believes they are perfectly healthy. Then, the invisible crisis violently breaches the surface deep inside the chest. That decades-old plaque finally cracks open. The body detects this internal crack and reacts to it, exactly like an external wound. It immediately rushes clothing agents to the site to seal the damage. In this cross-section, we can see the overcompensation. The clot expands rapidly until it completely seals off the narrow artery. Without the blood flow, the heart muscle sitting directly beyond that blockage is instantly starved of oxygen. Individual cells begin to die off, setting a relentless biological clock into motion. This microscopic failure registers on the outside as a crushing pressure, as if a heavy weight has been dropped directly on the chest. The sudden agony is the delayed broadcast of a systematic shutdown, triggered by the body's own attempt to heal itself. That dramatic chest-clutching collapse does not happen to everyone. The pain can radiate away from the center of the chest, travel down the left arm, or creep into the jaw or settle deep into the back. Women in particular frequently experience atypical symptoms that lack obvious warning signs. Instead of severe chest pain, they might feel a wave of sudden fatigue, a dull ache in the jaw, or even severe nausea. And because these particular signs closely mimic the flu or simple exhaustion, they are easily dismissed, leading to delays in seeking help that can prove fatal. And when the warning signs are misunderstood, the ticking clock becomes harder to beat. Once the blockage occurs, the hospital becomes the final arena. Emergency responders operate under a single doctrine: time is muscle. This progress bar maps the window for survival. If a patient reaches the 90 minutes mark without oxygen, damage to the heart muscle shifts from reversible to permanent. If the blockage persists for 6 hours, large portions of the heart machineries are destroyed forever. Because this window closes so quickly, calling for emergency help immediately is mandatory, regardless of how mild the symptoms feel. Beating that clock is the difference between living with a crippled heart and making a full return to your life. Survival is dictated by the speed of the medical intervention, turning the entire recovery process into a race against an invisible clock.